The holidays are meant to be joyful, but for many families, they can also be one of the most dangerous times of the year for heart health.
Yes, so today cardiologist Dr. Garrett Stanford from Washington Regional is joining us to talk about why heart attacks spike during the holidays, what warning signs to watch for, and how to protect yourself and your loved ones. Thanks for being
thanks
here,
for being
Dr.
here.
Yeah,
Stanford.
thank you for having me.
Of course,
Absolutely. So why do we kind of see these spikes happen, especially during Christmas?
Okay. Well, to start off, we've known for more than a century that heart attacks, fatal heart attacks, are more common during the winter months. You know, when it's cold, blood vessels constrict, blood pressure goes up. There is more of a tendency for the heart to form blood clots within the vessels because plaque that is vulnerable has more of a likelihood to rupture. But interestingly enough, in the last 20 years, we've noticed that on Christmas Day, in particular, that fatal heart attacks are even higher than can just be explained with cold weather alone. So there's some other factors that have been, looked into to see if we can figure out why this is occurring.
Yeah, certainly. And you've got that cold weather, as you mentioned. You've got the stress of the holiday season, maybe eating some rich foods. How do those factors combine to put an extra strain on the heart this season?
Well, people change their schedules. It's a lot more hectic during the holidays. You have folks that are traveling. Sometimes people forget to take their medications with them when they're traveling. People that are home but they have guests, they're in a different schedule. They may forget to take their medications as was prescribed above. And then, there's family stressors, interactions between family members that I think we can all understand that bring stress.
Right.
And then, there's also grief for some people. They're missing family members who have passed. And it brings, grief and depression during the holiday season too. And then we also have to remember that a lot of these people have financial stress. Christmas, they feel guilty. Maybe they didn't get their loved ones what they really wanted to, and then, they spent a lot of money, and then in January things roll around and they're, going to be pinching pennies. So stress plays a big, important role. And you ask about rich foods and what have you, et cetera. People do tend to overindulge in food and drink, which also puts stress on the heart during the holidays. But I think the overall thing that we know from studies that really increases the risk is the delay in care.
Okay.
People can have symptoms that tend to be typical of angina, which is a lack of blood supply to the heart, but people, when they're away from home and they're away from their provider, they would rather wait to get back to their own provider to discuss it. If somebody has family over, they don't want to call an ambulance to get themselves taken care of in the middle of the festivities. They would wait and try to take care of it afterwards. And we've noticed this for a while because emergency department visits and admissions to the hospital for chest pain related admissions are actually down on Christmas, but spike soonly afterwards, right after Christmas. And that's been observed for many years. So we think it's probably the delay in care that really contributes for the fatal heart attacks that are happening outside of the hospital and at home.
Sure.
Wow. And you mentioned one, maybe you can share some other kind of warning signs that people should not ignore.
Absolutely. So a chest pressure or a chest heaviness that can be associated with a sweating. You feel a cold sweat. You get sick at your stomach. Sometimes just left arm pain, pain in the jaw on the left, or possibly neck pain on the left. And women in particular can have more vague more vague symptoms.
Sure.
Women don't always have chest pain, so it can just be some vague jaw discomfort, neck discomfort, arm pain, or maybe just sick at their stomach and just unexplained fatigue, things that don't always point to the heart. They just have to be a little bit more aware.
Yeah, that's right. Yeah, and I think we've got another graphic we can bring up talking about some protective things that you can do to protect your heart this season. You can prevent and protect. Dress warmly, eat and drink more moderately, stay active out there, keep those medications on schedule, just like you mentioned, doctor, and then find a way to manage that stress. So all of those things are important when you're thinking about heart health during the holiday season. We appreciate you. Thank you for stopping by.
Yeah,
and filling us
absolutely.
in.
Thank you very much.
Yeah, absolutely.